Hello friends, today we begin working early in the morning. You see it is very early, like a quarter past 7. So this patient has a recurrent varicocele. He is coming from Europe. He find our technique from internet, and as you know, we are performing varicocelectomy with a special new technique. We call this technique Istanbul Varicocelectomy technique. And in this technique, our main aim is to prevent recurrence, because unfortunately, recurrence rate after varicocele surgery, after a conventional varicocele surgery, is much more higher than reported in the researches. So in the researches, it's said there is a 95% success rate for varicocele operation when it is done under microscope. But unfortunately, it is not true. What is aimed in these reports are, if you do the varicocele surgery under microscope and ligate and cut all the veins, even the little tiny, very tiny ones, it has a high success rate. But in this case, there is a very high risk of giving some damage to small arterial branches. So many urologists do not take this risk, and they ligate the bigger veins and leave the little tiny veins that are beside the arteries, that are very close to arteries. And in that case, the blood circulation continues in the remaining veins and recurrence happens. So in our technique, we try to change this. We try to understand the nature of recurrence. And I use my Doppler ultrasonography for every patient by myself, not with a radiologist. I do it myself, and after the procedures, I recognize that the remaining veins after the first operation never disappear. They stay there and they cause the recurrence. So in our technique, we had many discussions with cardiovascular surgeons, and we changed the technique as we are taking out, we are removing the enlarged veins. This increased our success rate significantly, because inside the operation everything finishes. We take out these veins, external gubernacular and internal spermatic veins. Compared to classic microscopic varicocele surgery, we had this advantage, and compared to embolization, in the embolization they can't reach the external spermatic veins or gubernacular veins. So their success is around 70%, and I think the real success rate of a classical microscopical varicocele surgery is again 70%. In our operation, the success rate, I estimate it to be 97%. And it's a very good success rate, and it has immediate solution, especially for pain. The pain disappears immediately after the procedure with Istanbul Varicocelectomy technique. Thank you very much.